I think the Royal Colleges in general have a lot of respect and quite a lot of influence in society. So when we make even small gestures, I think it goes a long way. I think by nature GPs tend to be social activists. We like getting involved and getting stuck in, and that's certainly playing out in a big way. But I think there's something very special about GP's role, because we talk about planetary health and we talk about global climate change, but the reality is that the action that needs to be taken is local, and GPs are embedded in our local communities. We hear from our patients on a daily basis what's happening. There's a lot to support our members. As I say, there's a lot of energy out there. Our members want us to be engaged and want us to lead. So one thing we're doing, the Greener Practice Toolkit, is a very practical toolkit that practices can utilise. We've got about 1,400 practices that are signed up to that and using that on a regular basis. So that's really helpful. It's a toolkit and an award scheme as well. We're working with NHS England on zero carbon. And we're just about to appoint 50 advisor supporters around the country to help at a local level. They're just a few examples. I think there's some really practical things that we can do. As I say, we're still not doing enough, but we're getting there. As charitable bodies, there is a constraint to how political we can get. But I think sometimes we use that constraint as an excuse not to speak out when we need to, and I think we can speak out far more than we are doing, particularly around areas that relate specifically to health. I can't imagine the Charity Commission getting us into trouble if we speak out about health matters. I think the medical profession in particular has lost its roots in public health, certainly Victorian roots in public health, and we need to reinvigorate that. And I think that's happening in general practice. I think it's in a really exciting way. I think GPs are becoming more and more aware of the lack of impact of the application of the medical model in so much of what we do, and the extent to which so much of what we do is a product of the social determinants of health, of which clearly climate change is a major part.